Okay, so welcome to today's webinar, and we are going to talk about my series on ophthalmic cases, and that is the main specialty where I'm going to talk about homeopathy and how homeopathy has a scope in ophthalmic cases. I come from a rich lineage of ophthalmologists. Both my parents are ophthalmologists, and I'm a homeopath by default, but I specialize in seeing a lot of ophthalmic cases. Today, I'm going to talk to you about squint and some of my cases of squint, especially early squint, and how we can manage with homeopathy. Cases of strabismus, heterotropia, and crossed eyes. Squint or strabismus condition where eye do not properly align with each other when looking at object, and the eye that is focused on object can alternate. Typically, you could see either a convergent or a divergent squint. There are many causes: infection, trauma, genetic, hereditary, which is very common, brain issues, muscular dysfunction. Many risk factors are there. Typically, the type of squints you can see normal. You can see esotropia, eye turn inwards. You can see exotropia, eye turn outward. You can see hypertropia, eye turned upward. Hypotropia, eye turned downward. So there are different types. The more common you will see is more convergent and divergent. Especially in children, you will see this very commonly. Um, you know that there are muscles, extraocular muscles. Many times the weakness of muscles can cause this. Why I tell you this is because homeopathy has in it particular capacity to work on these muscles. There are remedies like natramur, silica, ruta, which can act on the muscles. Nerves can be one of the other issues as well. What are the common symptoms? Double vision, eye pain, and psychologically it can affect. Um, you can see typically the symptom lazy eye, difficulty in reading, unstable vision, double vision, decreased vision, deviations, and one of the commonest tests are history taking, physical examination, Hirschberg test. Um, Many treatments are there, glasses, surgery is an option, but I want to talk to you about homeopathic approach because I believe that first let us try to treat every condition naturally, and if it doesn't work out, surgery is option, or many times even post surgery when things don't help, homeopathy is option. So what we try to do in homeopathy is even in these type of cases of squint or all these type of ophthalmic cases, we try to understand the deeper state. We try to understand the person in the disease. Many times there are minute symptoms, stress levels, stress factors, reactions, sensitivities, and we try to understand this. And on this basis, we give homeopathic remedy, which in turn acts at the immune system level, acts at the muscular level, nerve level, and can help heal, stabilize the condition. It depends from case to case how patients react, but homeopathy has a tremendous role. I recently had a case of squint, very bad squint, a little divergent squint, and a child. I studied her case in depth, and one of her main thing was uh, a need for appreciation and creativity. And I gave her the remedy anti-money crude, and beautifully the child is improving. It's been more than a year now. This is my email ID, and my clinic is in Mumbai, in Dadar. So please do write to me about these kind of cases.